In the past, healthcare was about privacy, intimacy. Now there is a computer between the patient and his doctor. Social media is online conversations. Health 2.0 is social media entering the healthcare arena. Patient networks exchange medical information. They track the R&D pipelines of the pharmaceutical companies. They can report adverse effects directly to the authorities, even do clinical trials and provide statistics. They can rate doctors, they rate drugs, pharmaceutical companies, hospitals, health policy decisions. One thing you need to know is that Health 2.0 is not a niche phenomenon. It will drastically change the entire healthcare environment.
With Health 2.0, we see people increasingly going to the internet for their health information. There's a tremendous concern that when people are only getting their health information online, they're not entering the healthcare system. What we must not forget is the importance of the communication that occurs between an individual and their healthcare professional. And when they don't have the opportunity to sit down with their physician or nurse to really pinpoint the diagnosis, the concern, or the issue, that they may not be getting the full information that's important and tailored for their individual situation and needs.
When we talk about information, people worry about the accuracy, not just the Health 2.0 information, but generally the information that you can find on the internet. Sometimes this information are not backed up with clinical trials, not verified, not referenced, and might be incorrect. So this is a problem.
There's a movement that's starting to develop actually called information therapy. It's making sure that a person does enter the healthcare system and received evidence-based information at the right time, but in a way and a manner that is very usable for them and allows them to really move along the pathway to their own recovery.
I am personally convinced that Health 2.0 is here to stay and will definitely expand. Physicians, key opinion leaders, and even the pharmaceutical companies, you can help improve this information and transform it into something that is reliable and useful for everybody.
What we see happening is a whole new communication dynamic, whether it's through Health 2.0, whether it's through movements such as information therapy. No one can stay on the sideline. This is going to continue to grow and grow. And everybody that has an interest in good patient outcomes, whether it's NGO, a pharmaceutical company, policymakers, professional medical societies, and patients themselves, we all need to be part of ensuring that patients get the information that will lead to the best outcomes possible.
With effective communication, we can help the pharmaceutical companies not only to understand the phenomenon, but to engage into this trend. At the end of the day, the patient social networks and the pharmaceutical companies have the same goal: the right drug for the right people as quick as possible in the market.
As a communications company, we're experienced in working with all stakeholders. We understand the landscape and we understand the ways that will ensure the best outcomes possible for the patient.